Hi Suzanne, how are you?
I'm okay, thank you. You?
I'm very well, thank you. Would you like to introduce yourself?
So I'm Suzanne Dickson. I'm one of the lecturers on the mental health nursing course. I'm based at the Derby campus.
And do you want to give us a little overview of your career to date?
So I started my nursing career on a male acute admissions ward in Nottingham called A42, which is now closed down. It's a 20-bedded unit. And I worked there for about a year, learned loads of things. So really had a crash landing into kind of mental and physical health issues there. Then went on to A43 for a couple of months. That was a 22-bed female mental health acute ward. And that was mostly because we were transitioning to close that ward down as well. So we were really low on staff. So I went to help out there for a few months. Then I went on to Redwood 2, which was another female acute ward at Highbury Hospital, and stayed there for about a year before then getting the opportunity to go to mother and baby unit, which was an area that I'd always been interested in. I'd had a placement there. No, I didn't have a placement there, sorry. I had some bank healthcare assistantships there when I was a student at the Derby mother and baby unit, and I really enjoyed it. So I went for that, ended up staying there for 4 years whilst I finished my master's degree. And yeah, really enjoyed it. And then following that, it was kind of like, where do I go now? I'm not really somebody who likes to stay in the same place for too long and the same position for too long. So then I was really interested in teaching, and that's how I ended up. So I worked at University of Nottingham as a part-time secondment for 3 days a week for about a year, just short of a year, and then ended up applying to be at the University of Derby. So that's how I've ended up here.
So can you tell us about a patient story or a clinical story that you remember?
So I did have one lady that always sticks out in my mind. She was one of the first women that I worked with at the mother and baby unit. She was a lady who, she was quite young. She was, I think she was 19, just turned 19. She had psychotic depression, lots of social situations going on, but she was so poorly for such a long period of time. She was with us for about 6 months in total. So that was during her pregnancy, the late stages of pregnancy, and then while she was getting better. And it was just very complex to get her better. And I think one of the reasons I remember her is, one of them is because I was on shift when she went into labour, but I didn't even notice. So yeah, so then she ended up having electroconvulsive therapy, ECT, which again, I had come across people with ECT before. Usually you see it more in older adults rather than young women.
Yeah.
So that was quite interesting, the fact that it was completely flipped on its head when it comes to perinatal psychiatry. And she recovered very quickly after ECT, which is what we often see with the use of ECT. So that was something that really stood out to me. And I think generally, because we nursed her for such a long period of time, we really developed a relationship with her. But we also developed quite the relationship with her baby, who was really, really cute. He was really sweet. So, it was saying goodbye to him when they both got well enough for her to go on and kind of start her life with him. And so I think I will always remember her because of the relationship that we built during her long period of time with us. So yeah, I like to think about her.
Yeah, that's nice, isn't it? So if you weren't a nurse or a lecturer, what would you be doing?
So completely opposite side of the coin. So I used to always make clothes when I was younger, and they were absolute state. So I mean, it would be things like cutting them up and tying them back together with ribbons and things like that. And luckily I was a bit of a greb when I was younger, so it didn't really matter. It added to that grunge look that I had. But I always was really interested in making clothes, and I don't have an ounce of style, and I'm not fashionable at all. But what I do really like is costumes. So I love looking at documentaries about how costumes were made for film. So I'm a real film buff. Me and my husband are really into sci-fi and fantasy and all that sort of stuff. So I've always been interested in the costume. So I think if I was to do anything else and start from scratch, it would be being a costume designer. That would be a separate dream job. I feel like it's too late now to get into that.
It's never too late. It's never too late. So what's your guilty pleasure?
So I'm not even guilty about it, although I probably should be. So bearing in mind that I grew up in very much a rock household, so we were brought up on like Metallica, Nirvana, and Rage Against the Machine and all this sort of stuff. Like my guilty pleasure is I love the singer Pitbull. If anybody doesn't know who he is, he's absolutely awful, cheesy hip hop singer, rapper. I don't really know what he is, but he's very cheesy and not really the sort of person that I would love at all, but I really, really love him. So it's like an ongoing joke with my friends that I'm a massive fanatic for his music. And we actually, I actually bought tickets to go see Britney Spears, like, God, it was a couple of years ago in Blackpool, purely just so I could see Pitbull. So the tickets were so expensive because they were for Britney. And then we got there, absolutely loved Pitbull, and then left when Britney got on stage. She was awful, to be fair. So we left straight away as soon as she got on stage and got a head start and getting back to Nottingham from Blackpool. So I do love it. It's one of my, it's on my bucket list to actually go and see him play headline in Miami, but he never headlines in the UK, which I think just adds to the fandom more than anything.
Well, I'll tell you what, I wouldn't have put you as a Pitbull fan, Suzanne.
No, I mean, this is the thing, isn't it? People don't, but, and like I say, I don't even feel guilty about it. I absolutely love it.
Brilliant. Well, that's well, you know, we've learned some stuff about you. I've learned some stuff about you. We'll see you soon, hopefully.
Thank you. Bye.
Thanks, Suzanne. Take care. Bye.